Hi, my name is Emily and I'm going to be the registered nurse taking care of you today. Can I please have your name and date of birth? Mary Edwards, and your birthday? 2/2/1940. Awesome. I'm going to start by washing my hands. Do you have any allergies? Okay, you're allergic to penicillin. All right, so I'm going to check my provider order, and you will be receiving bumetanide 0.5 milligrams IV push over 60 seconds. So there's no contraindications with your penicillin allergy, so of course we can continue. The next thing that I want to do is collect all of the supplies that I'll be using today. So I'm going to collect the medication out of our medication cabinet. So I have bumetanide, and it's 1 milligram per 4 mLs, and it's 0.25 milligrams per ml. So I have it right here, and I want to check the expiration date. And the expiration date is 4/2027, so this is good. I'm going to need normal saline flush for before and after the IV push of medication. I have it right here, and the expiration date is 6/6/21, so that's good, and I can open it. Here, I'm going to just grab another one. This is for the after, and it's 6/6/2021 again. It's good. Have it right here. The next thing that I need is a 3 ml syringe to draw up my medication. And I need a needle to draw up my medication, and the expiration date on that is also good, 11/30/23, and it's a 22 gauge, and it's 1.5 inch. This is what I will be doing to draw up my medication. I also need a pair of clean gloves, and I need alcohol prep pads. Okay, so everything is collected. I have everything that I need. The next thing that I'm going to do is wash my hands and put on my gloves. I'm going to put on my clean gloves, and we're going to prepare your medication. So the provider order again states bumetanide 0.5 milligrams IV push over 60 seconds. What we have here is bumetanide 1 milligram per 4 ml, 0.25 milligrams per ml. So our provider order reads we want 0.5. So I am going to be pulling up 2 mLs. So the first thing that I want to do is get my needle ready. I'm going to take it out. I'm going to take it out of here, and we want 2 mLs. I'm going to leave my cap in its safety package so nothing gets destroyed and everything remains sterile. Put it on, and I'm going to draw back 2 mLs. I have it ready, and I have my medication again, bumetanide 1 milligram per 4 mLs, 0.25 milligrams. We need 0.5, so I'm going to be pulling up 2 mLs. I'm going to remove the cap and discard it. I'm going to take one of my alcohol prep pads and clean the top of this. So it's clean. The next thing I'm going to do is decap my needle, and we are going to go directly into the bumetanide and push it in. And I'm going to pull back my 2 mLs of medication. Okay. I'm going to flick it so there is absolutely no air bubbles, and we want to recap it until we are prepared for administration, and I'm going to just push it up to make sure that it is 2. And we have 2. So now I have my 2 mLs prepared for when I am ready of bumetanide. Okay, so the next thing that I want to do is check my IV site. We're going to check for any redness or swelling, and it looks good, that there's no pain. There's also a lock on the IV, which is currently off, so I'm going to push it so it's open so that any fluid that goes through will go through cleanly and neatly, and there'll be no issues when I push it through. So the first thing that I want to do is grab my IV flush, which is a normal saline. I'm going to vigorously clean my port before I put the IV, before I attach the normal saline. So I'm going to vigorously clean it, which is good. So it's vigorously cleaned. I'm going to remove the cap off of my saline, and we want to make sure we push the air out so there's no issues, and I did, so I pushed it out. I am going to attach it to my port. You push and then you turn it. So the first thing that we want to do before we push through the normal saline is draw back a little bit, which is aspirating, and we just want to make sure that there's no blood return, and there is none. So then we can slowly push through, making sure we're checking for the patency of the IV as we push it through. This is a 10 ml syringe, and I want to put 3 mLs in to flush it, so I'm going to push it down slowly to 7. And again, I'm going to continue this, watching for the patency of the IV to make sure, checking if there's any pain for my patient. And so far, she's doing well. Perfect. That's 7 mLs. Well, that's 3 mLs. I pushed it down to the 7, so I know that I have done 3. I'm going to remove this, and then again, I'm going to discard it in my sharps and my other container. It's all over here to discard. So the next thing that I'm going to do is recheck my medication. I'm going to confirm that I have bumetanide, and I am doing 1 milligram per 4 mLs, 0.25 milligrams. That is the correct medication. Our provider order reads we want 0.5 milligrams IV push over 60 seconds. So I drew up 2 mLs, which is correct. I have it here. My patient is Mary Edwards. Her date of birth matches her name band. So I'm going to go ahead and re-clean my IV port. I'm going to remove the needle. So I'm going to get an alcohol prep pad. I'm going to vigorously clean my IV port one more time. I have the correct medication. I again checked it against my medication order and my patient's name band. I'm going to remove the safety cap, and I'm going to discard it. And I'm going to put my medication onto my port. They want to push this over 1 minute. So now that my IV is hooked up, we are going to slowly push this over 1 minute. I'm going to put my clock on. So 60 seconds on the clock. And we're going to slowly push it through. As I push it through, I'm checking for any signs and symptoms of an adverse reaction. Again, any sign and symptom of an infiltration, pain and swelling. So we're going slow. And she's tolerating it very well. So I'm at 30 seconds and I'm about halfway done. I'm at the 1 ml, so that's good. And I'm going to continue to push it through. Keep pushing. And I'm all done. So the timer is up. I pushed it over 60 seconds. I am going to remove and discard yet again. And then my final thing to do is again clean my IV port, and we are going to flush it with the final 3 mLs of normal saline. So what I want to do is clean my IV port again. Clean it vigorously and good to make sure that there is no risk for infection. Continue. So I cleaned it. Again, we're going to do 3 mLs. And I want to make sure that there's no air bubbles. I'm going to push it up. And there's not. I'm going to attach my normal saline to my IV port and turn. And again, we're going to do 3 mLs. I'm going to be doing it slowly and checking for patency. So I injected 3 mLs and we checked it for patency. I'm going to discard of all of my things. I'm going to clean up all of my stuff. Make sure that the IV site looks good, and it does. There's no pain or swelling. The patient states that she tolerated it well. The next thing that I want to do is leave the patient in a comfortable position. I'm going to give her the call bell to make sure if she ever needs anything, it's in reach. I'm going to remove my gloves and wash my hands. And then I just want to document what I had given. So today's date and time, and then I'm going to do the start time, which is bumetidine, 0.5 milligrams, IV push over 60 seconds, the IV site, and then my signature. And we're all set. I'm going to close the curtain for privacy, and that's my IV push medication.